I'm a 57-year-old disabled guy who lives alone in a high-rise apartment building. Throughout my life, I've mostly lived alone. I'm a loner by nature. I do value my time alone. That might seem unusual, but I like that at the end of the day, I can close my door and be alone. When that door closes, anxiety can set in. Being alone at home causes me to say, what if? What if my heart stops, just like Dad? What if I had a grand mal seizure like my brother Kevin? In my building, I've lost friends who have suffered rapid and debilitating life-threatening events. They died. This worries me. Could this happen to me? The other day I was visiting my friend Karen, who lives upstairs. She seemed upset. She told me about how she'd been having epileptic seizures regularly. Each time, after she'd regained consciousness, she would phone 911 and the ambulance would come and take her to the emergency room, sometimes up to 3 times a week. This was very exhausting. She was living a nightmare. She would wonder every day if it would be her last. She had an idea. Her seizures were coming on so quickly she couldn't even dial 3 numbers, but maybe she could use speed dial. Karen asked me if I would consider being her medical buddy. As her medical buddy, she calls me. When she's not there on the other end of the line, I know I'm to dial 911 and I'm on my way to her apartment. I'm able to buzz the paramedics into the building without delay, and they're able to administer medication very quickly. Essentially, they are intervening in the seizure. This has been a game changer. When Karen receives medical treatment quickly, within 25 minutes, she calms down and EMS is on their way out the door. She gets to stay and recover in her own home, which is very important to her to feel secure in her life. But there was something else. Part of Karen's story was horrifying to me. Why all the seizures? Something's up. So we talked, and Karen went back to her doctor to review her medication. Her doctor has since increased her medication, and since the change, she has been seizure-free. Even without the inconvenience of the seizures, the possibility still exists. Having me as her medical buddy gives Karen a new sense of confidence and great comfort. She doesn't feel alone in managing her health conditions anymore. When you live alone in a big apartment building and you use a cell phone, you're at great risk. Our health system works, but the call needs to go out. EMS needs to know to come if you need help. Having someone close who can call 911 for you is so important. Having someone you can count on can be the difference between feeling alone and having hope. I am currently still looking for a medical buddy of my own.